guys, Dr. Chad here today with another interesting case. This case is very interesting because it really plays to a lot of people in our part of the woods. We have such a blue-collar working force here in South Louisiana. Arthritis of our spine is very common. What I call arthritis of the spine is Facet Syndrome. The facet joint are these little guys back here. This represents the low back, obviously, and the facet sits side by side, so it acts like a hinge. This is the type of pain that a lot of patients experience with mopping, with sweeping, with twisting type maneuvers. As we age, these joints start to become bone on bone. So I say we have a rusty hinge, which is why as we age, we start to lean forward. So people with Facet Syndrome feel better going forward. They hate leaning back, they hate twisting. Patients with Facet Syndrome like to sleep with pillows under their knees because that takes the pressure off the Facet Syndrome. When you look at the MRI of someone with Facet Syndrome or spondylosis, arthritic issues, there's not really a one thing that sticks out. I used to say patients with these syndromes have multiple issues: degenerative disc disease, some mild disc bulges, and obviously the arthritis in the back. This is death by 1,000 cuts. So it's not like you have one simple thing wrong with your back. There's nothing surgical, but unfortunately, all those wear and tear type things add up to someone with a significant arthritic back. Where do we start with treatment is you always want to start simple. Conservative care, physical therapy, chiropractors, Pilates, yoga, core strengthening type stuff. The type of things that work on this from a medication standpoint would be anti-inflammatories, muscle relaxers, topical pain creams, tinge unit, the little sticky pads that vibrate on your back can be helpful for this. More what we focus on is not always just treatment, but prevention, proper mechanics. My father as a welder lifted so many years with his back as opposed to his legs, and that advanced the arthritis in his spine faster than someone with not a mechanical job or lifting appropriately. So always make sure when you're lifting, your spine is vertical, you're not hunched over, you're not straining your back, because obviously those type of things are going to worsen this type of syndrome. When all those things don't work, or the syndrome becomes worse to the point that it's debilitating, then we start talking about interventional procedures, and we're going to discuss one that I love doing and I do a lot of, which is a lumbar rhizotomy, and I have some pictures I'm going to show you. So we're looking at what's called an AP picture of the spine, so this is exactly what we're looking at. And the idea behind a lumbar rhizotomy is I can't change the underlying arthritis of the joint and I can't make it go back to normal, but if I destroy the nerve that picks up the sensation of the joint, then I can make it so the patient doesn't feel it. Obviously, we're not talking about the big nerve that controls their leg, because burning that would be very bad for obvious reasons. But there is a small nerve that goes right into this groove that comes back and picks up the sensation of the joint. That nerve is called the medial branch nerve. And we do a diagnostic block first where we numb the nerve, and then we come see the patient after, examine them, move them side to side, and see whether or not the Facet Syndrome is truly the right diagnosis. If it is, then we come back with this needle here, and you can see the white sheath as the insulation, and at the tip you do not have insulation, so this is where the burn will happen. We place the needle right on the apex of that curve on the bone, and this is exactly where that little medial branch nerve goes to get to the facet joint. Once the needle is in place, the stylet comes out, a wire goes in, connects to a generator, tip of the needle heats up, and it burns the nerve. If you look at the literature, the nerve destroys from anywhere from 8 to 16 months, but I can tell you the clinical relief from this procedure can vary depending on the patient, their weight, their activity, how much arthritis they have. So there's a lot of variables as to how long this procedure works. This is an image of the actual procedure. You can see the needles coming in, making contact with the bone. So this is what interventional pain physicians are looking at as they're driving the needle to get to this nerve. Once the needle's down there, they do some testing to make sure they're on the right needle, and then they create a heat lesion, which is very small, to destroy this nerve. I always tell patients after you get a rhizotomy that's only one part of the treatment. The next thing is you have to rehab your back. physical therapy, chiropractor, Pilates, yoga, exercise. But again, I didn't fix the underlying joint problem. I'm just making it so they don't feel it as much. So the more that they can do to rehab that back, the better this procedure is going to work. So again, lumbar facet syndrome, very common. You can have it in your neck, you can have it in your mid-back, but the low back is obviously one of the most common areas we see it due to the rotation and the physical activities, again, especially in our neck of the woods. So I hope this was helpful. I hope, if you ever have issues with back problems, that a simple rhizotomy procedure can be helpful. If you have any questions about this syndrome, whether or not you have it, please come see me in my office and do a consultation, and we'll review things and decide whether or not this is appropriate for you. So as always, thanks for tuning in. Hope this was helpful for you guys, and I'll see you soon. Take care.